Welcome to the Department for Radiotherapy at the Northern Centre for Cancer Care here in the Freeman Hospital in Newcastle. The aim of this short film is to provide you with general information about radiotherapy treatment, to answer some of your most frequently asked questions, and to introduce you to our department and some of our staff who you may meet when you visit. We hope you find it useful, and if you have any further questions, please ask your oncologist, radiographer or nurse. You should have been informed about how to get to the centre with your treatment appointment schedule. If you are coming by car, you can use the sat-nav postcode NE7 7DN. The hospital is clearly signposted from all the main routes. There is parking available in the multi-storey car park close to the centre. There are designated spaces for disabled parking opposite the centre, and a drop-off point outside the main entrance. Further car parking is available in the two main car parks at the front of the hospital. The hospital is also served by a number of bus services. The closest metro station is Long Benton, which is a 7-minute walk away, and the metro connects to mainline railway services at Newcastle Central. There is a walkway from the metro station to the hospitals. Taxis can drop off and pick up at all hospital entrances. You will enter the Northern Centre for Cancer Care on Level 2. You should take the stairs or the lift down to the Radiotherapy department on Level 1. It is very important that you let staff there know that you are here. Reception staff will check you in at the Radiotherapy red desk and then direct you to the appropriate waiting area.
We're exceptionally fortunate working in Newcastle because we very much function as a team. So I'd like to think that if you or a family member were treated in Newcastle, that you would find yourself arriving at a very warm, welcoming place. I think most people who are diagnosed with cancer and who are perhaps about to embark on treatment for cancer are understandably nervous and anxious. But the message I hear time and time again, having spoken to patients, is that once they arrive, once they've got to know some of the staff, most people feel very quickly that they're put at their ease. And I think that's one of the most important things for me, is that people will feel comforted and reassured by what is a great team and a very professional team at that.
What is radiotherapy? Radiotherapy is the treatment of cancer using high-energy X-rays. The consent process forms a large part of your first consultation. It will be carried out by a clinical oncologist or specialist radiographer and confirmed by your treatment radiographer. This is to ensure you receive all the information you need to make an informed decision about whether to go ahead with your treatment. You will be treated by male and female radiographers, and as the Freeman Hospital is a teaching hospital, there may also be students present. We will discuss with you the benefits, side effects, and alternatives to having this treatment. We will also explain what happens if you don't have the treatment and what happens if you choose to go ahead. Your first appointment will be for pre-treatment. Some patients may need to have special devices tailor-made to help keep you in the correct position for each treatment. This takes place in the mould room.
Can you just confirm to me whereabouts on your body you're expecting to have that treatment to?
The mould room. For certain types of cancer, like head and neck cancer, you may need to wear a mask. This helps us to provide accurate delivery of treatment on every visit. For other types of cancer, you may need to wear a specially made mould, shell or shield during your radiotherapy to help keep you in the correct position or to protect parts of your body around the treatment area. It is important to keep the parts of the body being treated as still as possible.
Sometimes people are a little bit nervous when they come in. It's actually a very quick procedure. So when you have the mask made, you're only with us probably for about 20 minutes. The actual material on your face is very soft when it goes on. It's almost like a warm flannel or a warm towel when it goes onto your face. And it's only actually on your skin for about 8 minutes. So it's a very quick process, and quite a lot of people actually say the warmth of the material when it goes on is actually quite pleasant. So what we're going to make for you now, it's called a vac bag. They're basically a bean bag that we mould around your body. It's just all about the reproducibility, about getting the patient laid exactly the same way every single day.
Planning a course of radiotherapy treatment is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 10 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor and they will ask you to confirm your consent. They will also explain what clothing needs to be removed and help you achieve a comfortable position, which you will repeat each time you attend for treatment. Keeping still for the scan is very important, so if you are not comfortable, please tell the radiographer and they will try and make some adjustments.
When you come for your CT scan, we need to make sure that we've mapped out which area we want to treat so that when you come back, we know exactly what position you've been in. So that's what we're kind of aiming to do with the CT scan. So we need to pick a stable position on you to basically set you up so that your treatment's accurate and that we can get you in exactly the same position.
The planning scan. It is important to take your usual medication on time before any appointment. Please also bring a list of all your current medication and planned medication. You can eat and drink normally before your appointment unless we advise you otherwise. We will highlight if you require a treatment where it is not recommended. You are very welcome to bring a friend or relative with you. We do ask them to wait in the waiting room while we perform the planning scan. You may be required to remove clothing for scans and treatment. You will be treated with dignity and respect at all times. Some patients need to have a planning CT scan with contrast. This involves an injection of a drug which enhances the appearance of some internal organs on your planning scans. This aids the clinicians in defining the area that requires treatment. If you need to have a contrast scan, you will be told about this when you attend for your planning appointment. You may be asked to remove jewellery, watches or hearing aids before your appointment. If this is the case, staff at the appointment will let you know. You may find it more comfortable to leave these at home. At the end of the planning scan, the radiographers will make some small tattoo marks to help the treatment team to position you when you come for treatment.
The permanent marks, the tattoos, we put them on a stable position on your body to make sure that we can then get you back in the same place when you have your treatment. So they are very important. You might not think so, they're only 3 little dots, but they are very important for us to be able to replicate that position when you come in for your radiotherapy.
Permanent marks. We need to put tiny marks on your skin to help us deliver accurate treatments at every appointment. This is done using dots of dye and will be permanent. The tattoos are very small marks about the size of a freckle. Treatment scheduling. Some treatment can be delivered on the same day. This can take some time, however, and you will be required to wait while your treatment is being planned. Other treatments take place over a set period of time. Your radiotherapy treatment may involve a single visit or multiple visits, dependent on your treatment plan. There is a dedicated team of therapeutic radiographers and dosimetrists who specialise in making the treatment plan. Every plan is made specifically for the individual patient. The team work with your consultant who will approve the plan and prescribe your dose of radiation. Once the plan and prescription is made, a series of thorough checks are completed before you commence treatment. A team of radiographers will treat you. You will be asked to lie on the treatment couch, and the radiographers will use the skin marks to position you in the right place under the treatment machine. Treatment times are usually very quick. You will be in and out of the room in about 10 to 15 minutes. Most of this time is preparing you, like getting undressed and positioning you. The treatment itself only takes a few minutes. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
Before we take you in, we'll have a chat with you just on what to expect. For most people, they don't know what to expect. It's quite a daunting experience. So we just want to make sure that you know, and we give you the information that you need before you enter, know what to expect with the machine. In the treatment room itself, we'll talk you through everything, so if we're doing any measurements or anything like that, and we'll answer any questions you have before we take you in as well. And before we leave the treatment room, we normally do say to you that we're about to leave the room. There are cameras in the room, so we are watching you at all times. And if you ever want the treatment to stop or to pause for any reason at all, we always say just give us a wave. You know, we'll come straight back in. So not to worry about that, because we can always do the treatment again and to start again from scratch. The machine can come quite close to you at times. It depends on how it's been planned, but most of the time nothing will touch you at all. We normally do put on music in the treatment room, so if you have any preferences, we can always normally kind of accommodate that just to take your mind off of it. The machine is not noisy. You might just hear a buzzing noise when it comes on, but it's generally quite quick. So most treatments are normally less than 5 minutes, so you'll only be in the treatment room for about 5 minutes or so on your own. Some treatments do take longer, but we tell you that if it's going to take any longer than 5 minutes.
Your doctor or specialist review radiographer will see you regularly in the outpatient clinic during the course of your treatment. These appointments will be planned to coincide with your visits to the department. This is your opportunity to discuss any concerns you may have and for us to assess how you are tolerating the treatment. It is also important you tell us about any medication you are receiving, and also if you have to attend other hospital appointments or attend for any other investigations. Your consultant will have discussed any potential side effects from your treatment with you. Not everybody gets side effects, and this does depend on the treatment site. There is more information about side effects in our other video. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.